Hi everyone, Dr. Lapushnian here, also known as Boston PMD or Penis Whisperer, and welcome back to my channel, Boston PMD. So today I wanted to talk about an issue that I see quite a bit in my clinic, and it is testicular pain. And there are really two separate kinds of testicular pain. There's an acute testicular pain, meaning everything was fine and all of a sudden it just hurts. And there's a chronic testicular pain, meaning, it's been hurting for a while. I've seen a few doctors, it still hurts. I did a couple of things, it doesn't work. So this video is specifically about acute testicular pain, meaning, it's been hurting for not too long and it never felt that way. If you're interested in the other kind, check out the next video about the chronic testicular pain. But anyway, let's go back to the acute testicular pain. So most of the time, there are three separate entities that can cause it. The first one is trauma. We see this a lot with baseball injuries or like kids falling on the bike and like a startle injury. And that's just because, the testicle gets hit and it hurts. And sometimes it can also cause something called hematoma or bleeding around the testicle. It can also cause testicular rupture, meaning when the testicle just blows up. So if you had testicular trauma and it hurts, please, please, please go either to the hospital or even in urgent care, or if you have a urologist who you can see right away, and have them check it out, because really what you want to make sure you do not have is testicular rupture or significant bleeding around the testicle. So that's number one. Number two cause for acute testicular pain is infection related. And fancy names for those are either orchitis, meaning infection of the testicle, or epididymitis. And epididymitis is the inflammation or infection of the epididymis. Epididymis is a little mohawk-like structure that sits on top of the testicle. And that's where sperm gets matured before it gets delivered through the ejaculate. So that can get inflamed and infected as well and hurt quite a bit. Usually, people who get orchitis or epididymitis will say, you know what, it kind of started hurting, didn't think much of it, but then like a day or two later, it really started hurting. That is usually treated pretty easily with antibiotics and anti-inflammatories such as ibuprofen or meloxicam, and people recover quite well. The risk factors that make you prone to orchitis or epididymitis, meaning inflammation, infection of the testicle or epididymis, are things like sexually transmitted infections, incomplete emptying of the bladder, or bladder infections. And then the third very important entity that can cause very acute, very severe testicular pain, along with nausea and vomiting, is something called torsion. And that is more common in young patients, teenagers or early 20s. It's very uncommon to see in people who are older, like 50s, 60s, 70s. It just doesn't happen that much. But what torsion is when the testicle rotates around its axis. And what that does, that pinches off blood flow to the testicle and causes severe testicular pain. You will frequently see also patients complaining of nausea and vomiting at the same time because the pain is so bad. If that is the case, you must get to the hospital right away and have them check it out. Because if it's truly testicular torsion, you will require pretty urgent or emergent intervention to untwist the testicle. If you let it go for, more than 12 hours or so, there's a really high chance that the testicle may not survive. But if you get to the hospital and gets addressed within 6 hours, the rate of survival of the testicle after torsion are excellent. So those are the quick and dirty three main causes of acute testicular pain, and there's a write-up of them right under the video, and the next video will be chronic testicular pain, which is very exciting. See you next time.